The world of COPD treatment is undergoing a silent revolution, and it's about time we paid attention. For years, managing chronic obstructive pulmonary disease, COPD, meant relying heavily on inhaled medications, but a new era is dawning, one that promises a more personalized and biologically nuanced approach. But here's where it gets exciting. Recent advancements suggest that COPD is not a one-size-fits-all condition but a complex spectrum of phenotypes and inflammatory patterns, demanding a shift towards tailored patient care. This paradigm shift has been fueled by the introduction of biologic therapies, particularly for patients with eosinophilic COPD. The 2024 approval of dupilumab marked a significant milestone, offering a novel treatment option for those who continue to struggle with exacerbations despite optimal inhaled therapies. And this is just the beginning. Mepolizumab followed suit in 2025, and the pipeline of potential new treatments is growing. However, with this progress comes a host of practical challenges. How do we identify the right patients? How effective are these treatments in the real world? How do we manage fluctuating biomarkers and navigate the complexities of insurance approvals? To address these questions, a panel of experts, led by Dr. Mylan K. Han, recently gathered at an HCP Live clinical forum. Their discussions shed light on the evolving role of pulmonologists and severe airways specialists in integrating biologics into COPD care. The conversation delved into the intricacies of diagnosing complex airway diseases, interpreting eosinophil thresholds, and differentiating between asthma-COPD overlap and pure COPD. But here's where it gets controversial. Should treatment be guided by rigid protocols or tailored around treatable traits? The panel's insights reveal a field in transition, balancing traditional therapies with cutting-edge precision tools. One of the most striking takeaways was the persistence of long-standing challenges in COPD management: misdiagnosis, delayed referrals, inhaler misuse, and poor adherence. These issues, though not new, significantly impact how patients respond to even the most advanced treatments. And this is the part most people miss: the importance of deeper phenotyping at the point of care. Clinicians emphasized the need to carefully interpret eosinophils, exacerbation patterns, imaging findings, and symptom profiles to make informed decisions. Eosinophils, while valuable, should guide, not dictate, treatment choices, given their variability and the need for a broader clinical context. The discussion also highlighted the real-world deployment of biologics, with clinicians sharing their criteria for initiating therapy in highly symptomatic patients or frequent exacerbators. But here's the catch: operational barriers like documentation, insurance approvals, and infusion logistics can complicate access. Moreover, the lack of COPD training among primary care physicians often leads to delayed referrals and suboptimal management. What if we told you that a broader education campaign could be the key to changing the disease trajectory? Ultimately, the forum underscored the need for a more individualized, treatable traits-driven model of COPD care. While biologics represent a significant advancement, they must be integrated thoughtfully alongside foundational elements like inhaler technique, pulmonary rehabilitation, risk factor modification, and long-term patient engagement. But we want to hear from you. Do you think this personalized approach is feasible in today's healthcare landscape? Or are there systemic barriers that need to be addressed first? Share your thoughts in the comments below, and let's spark a conversation that could shape the future of COPD care.